Thiazolidinediones, also known as glitazones, are a class of oral anti-diabetic agents that improve insulin sensitivity in peripheral tissues. They primarily act on adipose tissue, muscle, and the liver to enhance glucose uptake and utilization, making them effective in treating type 2 diabetes mellitus. In this video we will talk about some clinical pearls regarding glitazones. So, let's get started. Pearl number 1. Fluid retention and edema. Glitazones can cause fluid retention, leading to peripheral edema, and increased risk of heart failure, particularly in patients with pre-existing cardiac conditions. Patients should be monitored for signs of worsening heart failure, and glitazones should be avoided in those with significant fluid overload. Pearl number 2. Weight gain. Glitazones are associated with weight gain, which is dose-dependent, and can result from both fluid retention and increased subcutaneous fat deposition. This can be problematic in overweight or obese patients with type 2 diabetes. Pearl number 3. Bone fracture risk. Glitazones have been linked to an increased risk of bone fractures, particularly in women. This is thought to be due to decreased bone mineral density, especially in the distal limbs. Fracture risk should be considered, especially in postmenopausal women and others at risk of osteoporosis. Pearl number 4. Bladder cancer. Pioglitazone should be used with caution in patients with risk factors for bladder cancer, such as in smokers and individuals with family history of bladder cancer. So, long-term use should be avoided in patients with a history of bladder cancer. Pearl number 5. Hepatotoxicity monitoring. Liver enzymes should be monitored prior to starting glitazones therapy and periodically during treatment. If ALT levels rise to more than 3 times the upper limit of normal, therapy should be discontinued. In summary, glitazones improve insulin sensitivity and glycemic control in type 2 diabetes mellitus. While effective, they are associated with significant risks, including heart failure, fluid retention, weight gain, bone fractures, and potential bladder cancer. Proper patient selection and monitoring are critical for safe and effective use, especially in those with cardiac, renal, or hepatic concerns. So, that's all for today. Thanks for watching. If you found this video helpful, make sure to give it a thumbs up and hit that subscribe button for more content like this. Leave your thoughts or questions in the comments below, and I'll see you in the next video. Thank you.